Do you sometimes feel like your skin swells up, gets red, and hurts after a shot or insect bite, even if you weren't allergic before? That might not be a simple reaction. It could be something called the Arthus reaction. Think of it like your immune system overreacting, not the first time you meet an invader, but the second or third time. For example, imagine you got a vaccine, and days later, your arm turns red, swollen, and sore. No fever, but it really hurts to move. That's a classic clue. The Arthus reaction is a type 3 hypersensitivity, meaning your body's defense system mistakenly attacks its own tissues while trying to clear out foreign stuff. It's not common, but it happens when immunity goes into overdrive. What causes this overreaction? Picture this: you are given a vaccine like a tetanus shot, and your body makes antibodies to protect you. But if you get too many doses too close together, your blood gets flooded with these antibodies. Now, when the vaccine or any foreign protein enters again, the antibodies grab onto it and form what we call immune complexes. These tiny clusters float through your blood and get stuck in small blood vessels like clogs in a pipe. They often get trapped in skin joints or even kidneys. When they pile up, they cause inflammation. So the real cause is too much antibody meeting too much antigen, too fast, kind of like overpacking a suitcase, until it bursts. Repeated exposure, high doses, or frequent booster shots can trigger this. Now, how do you know if you're having an Arthus reaction? Let us say you got a booster shot 2 days ago. At first, no problem. But now your arm is hot, red, swollen, and painful, not just at the needle point, but spreading. Maybe you cannot fully lift it. That is a big sign. Unlike allergies, such as hives or trouble breathing, this happens 4 to 12 hours or even a few days later. Sometimes, small spots of dead skin appear, or even blisters. If the immune complexes travel, you might feel joint pain or nausea, but no fever. So if you are thinking, wait, this shot reaction is worse than my last one, even though I am not allergic, that is a red flag. It is not anaphylaxis, but it is serious and needs attention. How do doctors figure this out? They don't always run fancy tests. They mainly look at your symptoms and timing. Did you get a vaccine or injection recently? Is the reaction delayed and painful with swelling? That fits. Blood tests might show signs of inflammation, like high CRP. Sometimes, a skin biopsy shows immune complexes stuck in blood vessels, like finding fingerprints at a crime scene. There's no special cure, but treatment helps you feel better. Rest, ice, and anti-inflammatory drugs, like ibuprofen, reduce swelling. In tough cases, doctors may use corticosteroids to calm the immune storm. But stop the trigger. No more frequent boosters until your body resets. No antibiotics, because it's not an infection. You're healing your body's mistake, not killing germs. So how do you avoid this? Think of your immune system like a security team. If they're already on high alert, sending in more guards, antibodies, causes chaos. The best prevention: space out your vaccines. For example, don't get frequent tetanus boosters unless truly needed. Follow recommended schedules, not just in case doses. If you've had a bad local reaction before, tell your doctor. They might test your antibody levels first. If you're already protected, no need for another shot. Also, avoid repeated injections of animal-based medicines, like some old antivenoms. Slow and steady wins the race when training your immunity. Now what's new? Scientists are digging deeper into how immune complexes cause harm. Recent studies use imaging to track these clumps in blood vessels, like putting GPS on the bad guys. Researchers are also testing drugs that block specific inflammation triggers like C5 or IL-6 to stop the damage without shutting down the whole immune system. Another cool advance: personalized vaccine schedules using blood tests to check antibody levels before giving boosters. That way, only people who truly need another dose get it, cutting the risk of Arthus reactions. Some labs are even designing vaccines that trigger strong protection with fewer shots, smarter vaccines, not more shots.